Welcome back. We are in Studio B in our phone bank. We have healthcare navigators here. 758-1020 is the number for you to call to get your healthcare questions answered. Of course, open enrollment begins tomorrow.
Absolutely. And of course, it will be a 6-month-long period, so you have some time to do some research. We want to help you with that process. We have Melissa Watson from the Benefit Bank, one of the official navigators. And Melissa, you said a lot of people are just asking questions about the rates. We won't know the rates until tomorrow when the marketplace officially opens. But we do know that subsidies are available actually for low-income and middle-income families.
Yes, there are a number of different people who actually may qualify for assistance, not just with the premiums, but actually cost sharing, where it could help lower their out-of-pocket costs. And so the goal is not to make people pay too much for insurance. So it's one or two things. They could actually qualify for some financial assistance towards their premiums and that cost sharing, or they actually may be exempt from even having to have health insurance because of what their income is. What I've been telling everybody to do is call our 1-800 number at the Benefit Bank of South Carolina at 1-800-726-8774, because it's a number of different programs, even outside the marketplace, they may qualify for. What we've realized working with the state is that there are a number of people that actually qualify for Medicaid that don't even know they qualify that could be on it. So instead of, worrying about how much the premiums are going to be, looking at some of those different options available, because people may very well realize that it's not that much money because they do qualify for a number of different assistance.
And we've got people, asking questions about Medicaid, Medicare, they're unemployed.
Right.
How does this affect their care at the VA? You've been taking a lot of these calls and speaking with people one-on-one about this, about tomorrow. How do you gauge how people feel about this? Are their questions, are they concerned or just confused like so many of us?
It sounds like a little bit of both of confusion and concern. I can understand if you have a health insurance program, you want to make sure that what you have, and if you like it, you want to keep it. We've had several people calling about Medicare and Medicaid. If they have full medical coverage under those are considered qualified health plans, so they do cover what's needed. And then some people who don't have health insurance want to know how they can afford it because they do need that coverage. And as I said, there are a number of programs available to help with that cost so that it is not a financial burden on them. And even then, there are a lot of community programs available for people who may not be able to afford health insurance. So there's a lot available out there. If people give us a call, we can help direct them in the right direction.
Well, and I know you mentioned earlier that for a family of 4 that makes an income of up to what, 90 or 95,000?
Yeah, about 95,000. You're looking at some possible cost sharing and assistance there. So, you're talking about way out of what we would normally consider middle class, people who are actually able to get financial assistance, with premiums, reductions at those cost subsidies, or even cost sharing through the marketplace to help them be able to afford health insurance.
And we'll be digging a little bit deeper, getting into the nitty-gritty of it a little bit later at 7 p.m. Judy, you'll be in the phone bank with the Navigators, hopefully getting some simple answers.
Absolutely.
Tonight,
We want to give you the information. We want to make it easy to understand. The experts in our phone bank will be here until 8 o'clock tonight, so you have plenty of time to get through on the lines. The number to call is 758-1020, and we'll let Melissa get back on the line to talk with you guys right now. Melissa, thank you so much.
And we'll be right back.